Yeah, Assalamu alaikum wa rahmatullahi wa barakatuh. You are welcome to Oasis Muslim Care Foundation's second public health webinar. Our topic today is curbing viral hepatitis, protecting your liver and health. Our guest lecturer is Dr. Lukman Abdulkarim, a consultant physician and gastroenterologist and hepatologist at the University of Abuja Teaching Hospital. He's also the chairman of Enlightenment Initiative on Viral Hepatitis and NGO. Oasis Muslim Foundation is a foundation which caters to the health of the underprivileged majorly. But there's more to Oasis, and during the course of this lecture, our chairman will be talking more about what Oasis is and what Oasis does. We want to get started with the lecture, but before then, I want to give a brief profile of our guest lecturer. Dr. Lukman Abdulkarim obtained his MBBS in the College of Medicine, University of Ilorin. They call themselves Better by Far. He subsequently had his residency training in internal medicine with specialization in gastroenterology and hepatology at the University of Abuja Teaching Hospital, Abuja, Nigeria. He is a fellow of the West African College of Physicians and a fellow of the National Postgraduate Medical College of Nigeria. He currently works as a chief consultant physician, gastroenterology at the University of Abuja Teaching Hospital in Abuja, Nigeria. He's also a senior lecturer at the College of Health Sciences, University of Abuja in Abuja. He is engaged in clinical research, clinical and research work, as well as training and mentoring of medical students and resident doctors. He has presented papers in a number of medical conferences and has published a number of articles in local and international journals. He is the current chairman of the Enlightenment Initiative on Viral Hepatitis, EIVH, an NGO founded by a group of medical professionals with the purpose of scaling up awareness on viral hepatitis in Nigeria. He's a member of the Society for Gastroenterology and Hepatology in Nigeria, SOGHIN, American Gastroenterology Association, AGA, and a number of professional associations. Without further ado, please, Dr. Lukman Abdulkarim, you have the floor.
Okay, thank you very much. Thank you very much for the kind introduction. Thank you very much for this kind introduction. As you rightly said, I'm Dr. Lukman Abdulkarim, and I'm highly delighted to be here in your midst to talk about viral hepatitis. And the topic is curbing viral hepatitis, protecting your liver and health. You know, work-wise is what I do as my profession. It's something I do every day. And passion-wise, it's something that we want to see how we can curb the problem of viral hepatitis. Because when we see people with complications, it's not a good story at all. So we try to create awareness, and we've seen this as a very good avenue to create awareness about viral hepatitis. So I want to thank the organizers of this event for inviting me, to speak on this very important topic. The topic, as was rightly introduced, the topic is curbing viral hepatitis, protecting your liver and health. And the aim of this webinar is to enlighten the public about viral hepatitis, as well as to enlighten the public about viral hepatitis, particularly hepatitis B and C, which are the major causes of liver cirrhosis and liver cancers in our environment. And we know anytime we hear anything about cancers, it's not a good story at all. So hepatitis B and C are the major culprits when it comes to liver cirrhosis and liver cancers. So we look at other viral hepatitis and we'll see the importance, how it will be transmitted, how we can prevent it, and what to do if one is found to be infected with viral hepatitis. My disclosures, nil of notes, regarding this presentation. And just to take us back to biology, I believe we all did biology in secondary school, whether we liked the subject or not. Just a bit of biology. The liver is the second largest organ in the body, following the skin. The skin is the largest organ. I want to talk about internal organs. The liver is the largest internal organ in the body. And when we eat food, it goes through the esophagus, to the stomach, to the small intestine, and the large intestine. All the nutrients or whatever is absorbed through the digestive tract, because we have nutrients, at times drugs, at times toxins, at times bacteria, anything that is absorbed through the digestive tract goes into the bloodstream that we call the portal system, and that bloodstream goes into the liver first. And the liver helps in processing the nutrients, detoxifying things, drugs, and so on, before the blood passes to the heart. And before the heart now pumps such blood around the body. So the liver helps to serve as a gateway, for blood passing from the digestive tract before it goes into the systemic, circulation. So it has a very noble role to play. Now, when we look at the liver, function-wise, the liver performs over 500 functions in the body. Scientists have found more than 500 functions performed by the liver. And some of the major ones include the fact that it processes digested food from the intestine. It produces bile, which helps to digest fat and oil. Without bile, fat and oil will not be digested by the body. And it controls the level of fatty acids, amino acids, and glucose in the blood. It helps in combating infection. It helps in clearing the blood of particles and infections, including bacteria. And it helps in neutralizing and destroying drugs and toxins. In fact, some of the drugs we take, it's the liver that helps to break down the drugs, so that we can excrete such drugs. And it helps in storing iron, vitamins, and other essential chemicals, other essential minerals in the body. And it helps in regulating some hormone production in the body. It helps in forming blood clots, so that when we have a cut, we don't expect that we continue bleeding. A clot will be formed there. The liver produces what we call clotting factors that helps in, forming blood clots. And it helps in repair of damaged tissue. So we can just see just a few function of the liver we mentioned, and as we said, we have to list them one by one in details. There are over 500 functions, that the liver performs in the body. Now, what is hepatitis? If this were to be a classroom lecture, I love asking my students that what is hepatitis? I will look for volunteers to define what hepatitis is. I'm sure people will be thinking about different definitions now, for hepatitis. Now, hepatitis is just a marriage of two words, ancient Greek word hepa, meaning liver, and itis, meaning inflammation. And that just means liver inflammation. It just simply means that the liver is inflamed, or we could say inflammation of the liver. One of my lecturers back in school used to say, when you hear itis, it means inflammation. What you just need to know is the word preceding it, and that will tell you that that organ is inflamed. And such that when you have tonsillitis, it just means inflammation of the tonsils. Appendicitis, it just means inflammation of the appendix, and so on and so forth, just depending on the medical name for that organ. Now, what causes hepatitis? What causes inflammation of the liver? What could make the liver become inflamed? There are numerous causes. Most importantly are infections, particularly what we call the hepatotropic viruses. Hepatotropic, medical term just means that these are viruses that love the liver. They have a predilection for the liver. And notably, we have the hepatitis A, B, C, D, and E. And when we talk about these viruses, we'll talk more about them later, but we'll look at other viruses such as cytomegalovirus, herpes simplex virus, Epstein-Barr virus, a number of them. These other viruses, they don't have predilection for the liver, so they could infect so many organs in the body, including the liver. Then other infections such as bacterial infection, fungal infections, parasitic infections could all cause hepatitis. They could all make the liver become inflamed. Second to infections, we have alcohol. Alcohol is a very important cause of hepatitis. We have what we call alcoholic hepatitis, which could lead to alcoholic fatty liver, and that could lead to cirrhosis as well as liver cancer. Now, we also have drugs and other toxins, particularly herbal drugs, and even some orthodox drugs. We use them to treat something, but in the process of treating something, they could cause some inflammation, in the liver. So at times, some of these drugs may just be, the effect may be short-lived, so that when the person stops the drug, the inflammation of the liver stops. At times when the inflammation is so bad, we may even need to stop some of these orthodox drugs. Then the other causes of hepatitis, such as autoimmune causes, hereditary and genetic causes, and a number of other, causes. Now, when we now look at viral hepatitis, we see that it's a group of viruses that have a great predilection for the liver, called hepatotrophic viruses. And notably, we have hepatitis A, B, C, D, and E, where you could shortly, short form for them are HAV, HBV, HCV, and so on. Now, at times when we talk about hepatitis, some people ask that, is it hepatitis A? When it gets so bad, it graduates to hepatitis B. And when B gets so bad, it graduates to hepatitis C. No. These are just simply letters assigned to these viruses to distinguish them from one another. They are completely different viruses. The only common thing they have is that they all have predilection for the liver. Actually, hepatitis A was the first one to be discovered. And at that time, it was news that, there's a virus that will cause inflammation in the liver. And it was called infectious hepatitis. That means that the hepatitis that is caught through infection. After that, another virus was discovered that could, cause inflammation in the liver. That was hepatitis B. And the first one that was discovered was just named hepatitis A. The second one, they called it hepatitis B. Following that, later on, after some years, they discovered another virus, different from hepatitis A and B, that would cause inflammation in the liver. And it was initially named non-A, non-B viral hepatitis. And subsequently, it was named hepatitis C. And along the line, hepatitis D was discovered and labeled D. Along the line, E was discovered and labeled E. There are other minor viral hepatitis, that have been discovered, but they are not that common. We have hepatitis G, hepatitis T, and so on. Now, when we look at acute and chronic viral hepatitis, at times people will believe when you say, you have chronic hepatitis, people will believe that it's the severity that is referring to chronic. No, chronic in this term just means that it's a long-term infection. Now, all the viruses, hepatitis A, B, C, D, and E, can cause acute or what we call short-term illnesses. And this illness could just last for a few weeks, maximum 6 months. Within 6 months, this acute illness resolves completely without causing any significant damage to the liver. But we now have hepatitis B, C, and D that can cause chronic, that we call long-term disease. And these infections could last more than 6 months, could last for years, and in some people may be a lifelong infection. And this is where the major problem is. Once there's that lifelong infection or that infection for a long term, then it continues to cause repeated damage to the liver, leading to complications of cirrhosis and complications of liver cancer. It is worthy to note that hepatitis A and E, they do not cause chronic disease. And most times when people have hepatitis A and E, it just lasts a few weeks, maximum a few months, less than 6 months, it's completely resolved without any risk of it becoming chronic. Now, whether acute or chronic, the illness may be asymptomatic, meaning that some people may not have any symptoms. And they just get to know maybe when they do a checkup to check for the viruses, or they have a medical checkup and they see there's something going on in the liver, and they have to check for the viruses. At times it may be symptomatic. We look at the symptoms, subsequently. Now, by way of transmission, how does one get viral hepatitis? Hepatitis A and E are transmitted mainly through contaminated food and contaminated water. I tell people that once you've had food poisoning or diarrhea disease from contaminated food or water, then it's possible you could have had hepatitis A also. It's possible you could have had hepatitis E as well. In fact, in our environment, where